I want to tell you something about myself that I've never told anyone in this room. The autumn of my sophomore year of high school, I became ill. I began sleeping 9, 10, even 11 hours every day. I began sleeping in class, which is maybe not surprising to you, though, who studied with me. I even began falling asleep behind the wheel while driving on my hour-long commute every day. After a trip to the doctor, rife with blood tests and examinations, the doctor began asking me a series of uncomfortable personal questions. Finally, he stated with confidence, "I've determined your diagnosis," and he handed me a prescription for antidepressants. I was 16, and I was diagnosed as clinically depressed. In hindsight, I don't know what brought me to this place. Perhaps it was a succession of dramatic exits of people from my life. My mother moving to California, followed by my sister being incarcerated, followed by my other sister running away. I was left living with my father, who was battling both sleep apnea and manic depression, leaving him worn out from having no sleep and adjusting to Zoloft. I felt alone. For those of you unfamiliar with the embrace of depression, it is not some great sadness. It is not a searing sting of a broken heart, nor the long sigh of a rainy day. Depression is the great nothingness that swallows your soul. It spits you out in the cold and vast empty universe and shrouds the light that's within you. It is not red nor blue, but an endless sea of gray. In that doctor's office, I had a choice. I could accept that I was a broken person in a purposeless world. Or I could follow that, and I know where that dark journey ends, and I've lost a friend there. I could also choose to believe that no matter how bad, how hard, how cold, how confusing that I can, I will, I must push on through. But this choice required essential belief in me. I had to believe that my suffering served a purpose. I had to believe that my life served a purpose. If I wasn't destined for greatness, I just needed to know I had a chance. When someone says opium, you probably think of Tom Wingfield taunting his mother with trips to the opium den from Tennessee Williams' The Glass Menagerie. But the proposition states that, quote, religion remains the opiate of the masses, and I believe this requires some description. Opiates are painkillers. You probably are actually more familiar with them than you realize. Codeine, OxyContin, hydrocodone, morphine. These are life-saving drugs that spare people from the incredible pain during times of their greatest need. I was once prescribed opiates after a tonsillectomy. Codeine, I was on morphine during the surgery, and then after also Percocet. They're very powerful, but I'll tell you, one thing I'll never forget is one night I woke up after the drugs had worn off. And I had this searing pain so intense I couldn't even think. My throat was on fire as if I had swallowed lava. I know opiates are potent and potentially prone to abuse, but I honestly don't think I could have survived that week without them. Which brings me back to the moment in this doctor's office, holding this prescription. I made a choice. I walked out, I tore up the prescription, and I went to church. I went to church on Sunday, and then I went to youth group on Wednesday. I was driving 40 minutes each way, crossing a state line, and I dove headfirst into the dirty baptismal. I joined Bible study and then worship team. I didn't feel any less broken, but at least I felt like I could feel whole for a moment, even just a little. There was a man named Jesus who was born immaculately, loved radically, died horrifically, and rose miraculously just so I could feel whole. To be clear, I do not believe that religion can replace medicine, heal mental illness, nor is the answer for all social ills. But science is revealing the potent power of religious beliefs in physical and mental health. Dr. Harold Koenig of Duke University compiled 93 different studies that demonstrated that religious belief lowers feelings of depression and anxiety. Other studies have suggested that a sense of spirituality leads to longer lifespans. In American Grace, sociologist Robert Putnam found that participating in religious community, regardless of belief, correlated with higher levels of civic engagement. Is religion an opiate for the masses? You bet it is. It was for me in my darkest days, and it is for 84% of the world who believes in faith, religion, or God, or spirituality. That's 1 billion people right now, virtually everywhere. What's so important to note here is that religion doesn't have to be factually correct to be hugely powerful. You only have to believe it is. Whether I have a real relationship with a personal God, or I believe that there's a flying zombie, named Jesus, however you want to describe it, I could just be simply experiencing the effects of cognitive biases, whether survivor's bias, the conjunction fallacy, confirmation bias, or even the aptly named halo effect. It works like a drug. You'll hear the opposition explicitly defend religion outright, positing that it is inherently a force for good in an otherwise fallen world. I know better, and so do you. I've spent the last 8 years leading World Faith, a global nonprofit focused on ending religious violence. I've seen the scars of a young survivor of the 2002 riots of Gujarat. I've spoken with a mother of an EMT who died at his ambulance when the second tower fell on 9/11. I've borne witness to too much suffering caused by religion to say that it is inherently good. Moreover, goodness is not mutually exclusive to being an opiate. But I also ask you to listen keenly. I hope my fellow supporters of the proposition will abstain from the tired tirade of tyrants seeking to rid the world of religion. They may recount the silencing of women, abuse of children, and casualty of religious tyranny. But as a Christian myself, I know these criticisms hold true, but be not tempted by the narrative that seeks to banish religion to history with the same fervor of religious zealots. Let us not replace one conflict with another. Here is the fundamental truth. Religion is not inherently good nor bad. Like all social contracts from tribe to nation, culture to language, it can be a source of identity, meaning, and belonging. Similarly, opiates can help you heal or destroy your life. Both are a reflection of our human nature. Shitty and beautiful, we are the problem and the solution. Can I get an amen?